Welcome back. When we think about the dangers of extreme heat, we usually focus on the physical effects of the heat, understandably, but experts actually say mental health can take a hit too. This summer's heat wave is causing massive spike in anxiety-related hospital admissions nationwide. I have to be honest, this kind of took me by surprise. Joining me now to share more about the mental health toll and the signs is Dr. Jennifer Adams with HCA Health One. So thanks for being here.
Yeah.
There's air conditioning in the studio, so
Yes,
we provided that for you. Look, it has been brutal. Our weather team has been tracking this, like 28 days this month in the 90s, and every week for the past 4, I think, we've gone to triple digits. We focus a lot in the media about stay hydrated, stay cool, check on your neighbors, the elderly, but how is it taking a toll on our anxiety?
So when we're exposed to high temperatures and we can't get a break from it, it does create a physiological component where we're feeling dehydrated, our heart rates go up, we're not sleeping well, and that may impact us over the course of a week. And so that can lead to physiological symptoms of anxiety.
And so if we are prone to anxiety or other mental health issues, is this a situation where the heat would exacerbate it?
Absolutely.
So it's not like the heat would bring on some sort of mental health issue, but it exacerbates what you have because it's doing things physiologically.
Right, and if you're just someone who tends to get a little bit anxious, you can feel more agitated or irritable from this. And heat anxiety isn't like a true DSM diagnosis,
Right.
but it's really more an environmental stressor that can impact how we're feeling overall.
Okay, so when we talk about what we have to look out for when it comes to dehydration, the symptoms are there. And every year we hear something else, you're pinching your skin and you can figure it out. But what are the symptoms we need to look out for that, if we are prone to or if heat is going to affect our mental health? What are we looking for?
Well, basically it does look like those symptoms of anxiety. So you may be feeling more irritated, more agitated, more short with interactions with friends or family members. You might be feeling worried about being in the heat. I know one of my kids had a sports tournament outside this weekend, and I was sort of dreading, packing up, trying to figure out how many ice packs I needed to help us keep cool. So that planning element, if we know we have to be outside, whether for work or other activities, can be stressful. We might be worrying about our young children, our elderly loved ones. And for some people, it brings up worries about climate change and worries as well. So it may be, for people who are, concerned about the environment, those might be other worries that are getting activated as well.
That thought actually hit my mind this morning. I was looking at fires all over the country and thinking, wow,
Yeah.
this is got a little anxious about what the future looks like. What do people do? First of all, let me ask you, do you think this kind of heat anxiety affects adults more than it does kids?
I think it may show up differently. I think as adults, we may notice like the way we're thinking about it or just our like overall, emotions. Or
We can
thoughts
identify it.
We can identify it better. With our children, we may see them just being more fussy, more cranky. Might be harder to get them to settle in to take a nap if the house is warm. Or they might be dehydrated and that might be impacting how they're feeling. So, seeing that extra sort of, crankiness in our kiddos might be kind of expected.
My wife would say she sees that in me when it gets hot. Is it as simple as removing yourself from the heat?
That can definitely be the first step and probably the most effective step. Staying hydrated, getting breaks from the heat, whether that's in your home, going to a pool to get cooled off in the water, or taking breaks in a third space that's air conditioned, whether that's a heat relief center, going to the library, maybe sitting at the mall, where there is good air conditioning, but just getting into a place where you can get cool, get regulated, and try to get your body temperature cool before it's time for bed so that you can sleep well.
I'm not a medical professional, but I did raise 2 kids, and you sort of get to be a mini expert in certain things. But when should someone look and say, okay, getting out of the heat is not going to fix this? When should someone say, okay, I need to see a professional because I'm not feeling right?
Given that there's so many physiological symptoms associated with heat exposure, going to your calling or going to your primary healthcare provider can be a great first step. If you find that your Heat-related anxiety is more about worries, about to prepare for it, like how do I prep to go to work, how do I prep for my kids' activities, or larger concerns like we were talking about with climate change. That could be a time to also reach out to a behavioral health or a mental health care provider too.
Doctor, thanks so much.
Yeah, thank you.
Appreciate it. Nice
Great,
to meet
thanks,
you, and stay cool.
Great, yeah,
For
you
a
too.
number of different reasons, both your physical and your mental health.
Yep, we all got to stay cool.